it would seem that ignorance might be a way to say, well, we don't know about the problem, so why should we go and find out if we are gonna have to pay for those costs?
You ask really good questions, and I really appreciate it.
I firmly believe that if you guys hadn't gotten the information, nothing would be done. This wouldn't have happened today.
But it took 7 Investigate's Emily Davies reaching out to certain parties to begin to see changes.
Do you feel like that was the most appropriate way to do that?
Yes, I do, because another way would have been to put it in the paper.
You guys have done a really good job of reporting on this, probably better than any station in the state of Wisconsin.
Talking about how the backlog was really a great revenue generator for them. You know, what does that say to you?
It makes you feel kind of like you're being used.
Clark County Sheriff Scott Haynes didn't sugarcoat it. He says it was the sheriff's office responsibility and they, quote, dropped the ball.
You brought to my attention the most concerning thing is that the FBI apparently is only tracking the referred charge. That should change.
In fact, that's drastically changing from this big blue swath that covers Sawyer, Rusk, Taylor, and most of Marathon County to a really concentrated central Wisconsin.
About a dozen people filled these seats, which maybe doesn't sound like a lot, but that's 12 times the people that they typically have at these meetings. This is a 25-pack. And they're only legally allowed to sell 24 to an individual at a time.
The White House confirmed the vetting process that we've been reporting about over the last week.
According to records, this is the site of the main break and ultimate spill. It's just north of the wastewater treatment plant before it gets into the treatment plant.
The people of the town of Rome are not ignorant to the fact that the areas that are set to be clear-cut for this project are destined for that future anyway. Just not all at once. When outsiders characterize north central Wisconsin, it's often painted red. But many of the counties in the region gave the green light for Obama twice and picked up a majority of voters for Trump in 2016 and 2020. Wisconsin isn't won by counties or municipalities. It's each individual vote that brings us our state's winner. And even if you vote for red or blue or something else, every single voter has their nuanced reasons. That's why we're stepping into their shoes. We talked with people milling about downtown Wausau.
I live right up the street here.
Met up with voters at election events.
About politics, those are like my 2 favorite things.
And surveyed folks about what matters to them. While most didn't share who they would mark on the ballot, it was clear their shoes came in many shapes, sizes, and walks of life. And all but one are firm in their footing as to who has won their vote.
I haven't quite decided, but I have a good choice.
Trust me.
Yeah.
I'm going early.
During the search and after Aiden and Dakota were found, we had questions. You had questions. We wanted to understand what happened and if this could be prevented in the future. Then individuals with direct knowledge of the search efforts began to share their experiences and questions with us too.
He would always tell them, be good to your mom. You never know. Be good to your mom.
Mom, Rachel Griefey, and Aunt Brianna Shear describe Aiden Griefey as a spirited, funny person who always was looking to help others.
Knowing how he thinks of other people so much before himself, we wouldn't want to see that happen again.
No. As we look back at how we got here, reviewing dozens of reports, speaking to at least a dozen more people, analyzing timelines, and accounting for the numerous factors involved in that April day, there is no one single place to lay blame. Instead, there are a series of opportunities missed by a variety of people. To begin, the party places them in the forest on the far edge of the county. The weather plunging from 80 and sunny to below freezing and snowy with high winds are obstacles in themselves.
We've all been teenagers. You don't think of the consequences. You don't think this could happen to me. You don't think of the weather. I want kids to know that you need to consider everything.
It put them at grave risk of hypothermia, which is ultimately what killed them. Unfortunately, they didn't stop walking when sending their friends their location that morning. Their friends say they drove Shingle Mill Road searching for them, honking their horns and yelling. None of the teens called 911. They had been missing for 4 hours before Aiden's mom was called. She called 911 shortly after arriving, but it took time to get there, and it took time for the first deputy to arrive for the same reason.
We had a almost 5-hour delay from when they left until we were notified on Sunday, which, given the weather, did not help things.
Most, if not all, of Lincoln County's patrol staff responded Sunday. Some searched, others knocked on neighbors' doors, followed up on tips and reported sightings, or interviewed people. A couple of hours later, the DNR, emergency management, 3 fire departments, air support, and tracking canines were called in. Of course, we know how this effort ends. The search was suspended, or in some people's perception, canceled overnight. It resumed Monday with teams getting out into the woods late morning until Aiden and Dakota were found.
Could they have been found sooner? That is the question.
Randy Rouleau was the sergeant investigator of the case, working to figure out what caused the teens' deaths. He only agreed to interview with us over the phone.
I can look at it and say, do I believe some missteps occurred here? Yes.
About a month after the teens were found, he quit. Part of the reason, he says, is a difference in opinion between him and the agency about his findings.
I said, I believe my investigation, a portion of this shows that law enforcement dropped the ball here.
Aiden and Dakota were not dating, but one theory during the search was that they didn't want to be found.
The information that everybody relied on to conclude the search, her Snapchat account, the pings of Aiden's cell phone, and canine tracking, which led everybody to say they're no longer here. They left.
I can tell you there's a bazillion thoughts that came out at the command post on Monday. A lot of different ideas, and that's a good thing. Do we utilize every idea? No.
With deteriorating weather conditions and considerations for search crews' health and safety, one deputy made it clear to the Griefies that that theory won for the night.
I've been doing this for 25 years, and I'll admit when I'm wrong, but they're not out here. And I knew in my heart that she was wrong.
Law enforcement had information that they misinterpreted. Law enforcement failed to rely on the Detective Bureau to further assist in the search efforts.
That's assuming Sheriff's Office detectives would have interpreted those puzzle pieces correctly. Just after the search was called Sunday night, 6 fresh members of the Trail Ambassadors arrived, but were told to come back in the morning. Rouleau says there was no plan being formed overnight to allow a coordinated search to start at sunrise. He says command on Monday was caught by surprise.
There was no communications between the night shift patrol to the day shift patrol to continue this.
The sheriff's offices say Monday morning a new lieutenant did coordinate with the night shift patrol and the emergency management coordinator to create a plan.
He worked with the information that he had and then started getting assets going, and he was coordinating with Oneida County. So if there was time delays, I don't know what those were.
Some of that's waiting for your assets to regather and come back.
Since it's unclear exactly when Dakota and Aiden died, we'll never know if they could have been found alive with any of the suggested changes. Both Lieutenant Burkhart and Captain Young, who were not asked to respond on Sunday, say search crews can only work with the information they have.
You're getting all of your puzzle pieces and then trying to put them together. Whereas the further time goes on, you can take a look at that whole puzzle and you can see more clearly what the picture is and what you need to do.
There was no formal debrief, but both Burkhart and Young said they each talked with their teams about what they could do better.
What information we got together, and is there anything we could do different?
And I guess, what did you guys identify?
Tyler. Can I talk to Tyler for 1 second, please?
After that question, Oneida County asked to stop the interview for a discussion outside. Young returned and answered what could have been done differently.
We didn't come across any significant failures. Again, this is a situation where some people made some decisions, poor decisions, and they had tragic consequence. The law enforcement and first responders have to respond to people's choices that sometimes end in tragedy. That's what we discovered.
In law enforcement, I find that it's very results-based. If Aiden and Dakota would have been found elsewhere or found in the woods alive, nobody would be criticizing us. We strive to each time do better. And I stick to that. I think that we didn't do anything wrong, but there is room for improvement.
What personally I would have done differently is told them they couldn't stop, and I didn't say that. So that is going to haunt me probably for the rest of my life.
Lincoln County Sheriff Ken Schneider declined to be interviewed for this story. He said he would respond to some questions over email, but has yet to do so. Rouleau sent an email to the entire department saying this was the sheriff's circus, his mess to clean up, and that he was done. After he was placed on administrative leave, Rouleau reached an agreement with the county in October to resign. A request for Rouleau's report was denied because it's considered a draft and does not meet the definition of a public record. It's a draft because he technically quit before it was fully completed. Tomorrow, we look ahead at changes happening out of this tragedy.
It takes a lot for somebody to present into an emergency department in the first place for that type of, that type of disclosure.
Carmen Vasquez was a SANE or sexual assault nurse examiner until last week when she got a call and an email and now a letter telling her her specialized position is being eliminated. Marshfield Clinic tells us the program in Marshfield is being, quote, consolidated to the Weston Center without interruption. But it means those needing services in the Marshfield area will have to go north.
It really seemed like there were some great things happening, and then we received this news that services were discontinued. So that really took me off guard.
Renee Scholes is the executive director of a victim services center in Marshfield, serving Wood and Clark counties. Volunteer advocates from her organization make sure to meet patients at these exams, provide ongoing resources, and sometimes help with transportation too. Before the news, the program at Marshfield Clinic Medical Center Marshfield was about to increase fully trained staff from 2 to 6.
When someone is in trauma, there's a lot of emotion that goes along with it, and always questioning if they're doing the right thing, and you just never know at what point it's just going to be too much for them.
Scholes and Vasquez say it's not just people from Marshfield showing up at the hospital for these exams.
Sorry, you drove 45 minutes to come here in the first place. You'll have to go another 45 minutes. Almost always they won't take that up. They'll just be like, I'm not going to do it. It took everything in me to come here in the first place.
A really hard, sensitive issue to be able to disclose to, essentially strangers at that point in time. So they're talking to law enforcement about it, and they're talking to medical staff about it, and it's hard to tell people, about a very private thing that has happened.
Lieutenant Travis Esser with the Marshfield Police Department says while victims have all of the control throughout the process as to what they consent to having done or collected, not going through that exam, gathering that evidence in a timely manner, if at all, makes holding perpetrators accountable that much harder.
We will interview a suspect, and many times they will deny that it happened, or there will be a discrepancy over consent. And so the physical evidence obviously allows us to be able to say that this actually did happen.
It's unfortunate. It really is unfortunate when we have this medical facility here where we should be able to address those needs locally and really work hard to provide the best practice services that we can. And now we have to leave our community.
Now, at times, patients have already had to go outside of the community when there isn't a SANE nurse available in Marshfield, and typically a family member transports them or Scholes' organization has volunteers to help, but they say it's not the norm. She says it'll add complications for volunteers, possibly causing them to hire more staff dedicated to being able to travel. The women's community also had concerns in Wausau with the possibility of an influx of patients needing services, saying this decision is not victim-centered.
And what did Marshfield Clinic have to say about this?
Well, they say since there are about 3 exams needed a month, this will help nurses maintain their training and have enough nurses available at the Weston location. But I talked to several people at the Marshfield Center, and they don't feel this is a positive step.
In September, 7 Investigates obtained an internal memo from Marshfield Clinic alluding to financial challenges and likely major changes. In August, it filed a notice of changing bond terms due to financial difficulties. In September, we found reports stating Marshfield Clinic was extending lines of credit. It announced merger discussions with Essentia in October, to which Marshfield Clinic told us was not motivated by financial challenges, but to potentially create a premier integrated rural health system. The day before, sexual assault nurses in Marshfield were told the program was consolidating with Weston for business reasons. It filed a notice of a new financial obligation to help pay for other debt. Knowing all of that, Emily Davies digs into the system's finances and explains.
Marshfield Clinic is rooted in Marshfield. For more than a century, it's been branching out around north central Wisconsin, providing more than $600 million in community benefit, according to its latest community report. Numerous analyses and studies have looked at the impacts the financial health of hospitals have on the communities they serve. One 2019 study found strong evidence showing financially stable hospitals provide better patient experiences, lower readmission rates, and likely decrease negative quality and safety outcomes for patients. As 7 Investigates has seen departments consolidated or dissolved, we've offered Marshfield Clinic the opportunity to interview with us to explain, and they've declined, but have answered some questions over email. They told us in October they don't deny having financial difficulties. To many of our questions about these filings and developments, they said they aren't unusual, saying, there are costs associated with starting new facilities. However, our cash reserves are significantly larger than they were despite downturns in the financial markets. We are well regarded by the investment community.
The inflationary environment.
The director at Fitch Ratings, who provides their credit report, calls their vertical integration with hospitals, clinics, and insurance relatively unique.
We don't have that many providers that have the same structure. In this case, it has been a stabilizing factor. During the pandemic, when people weren't going and seeking healthcare, the revenues at Security Health Plan were stable and really helped to kind of stabilize the group when you look at all 3 pillars together.
Madeline Treadout, speaking to Fitch's 2021 ratings report on Marshfield Clinic, says the growth since 2017 does inch the system closer to reaching its capacity for debt, but
their growth strategy has been very well thought out and has not been growth for growth's sake. And we've had that conversation with them a lot because they did grow rather rapidly over a short period of time. And with that growth, there's going to be integration.
She echoed what Marshfield Clinic said, that there will be frustrations in staffing and operations as it grows. The pandemic threw a wrench into those plans for most of the healthcare industry.
Before COVID, over half the nation's rural hospitals were at risk for closure. It was a terrible time, and then we shut down all services for these small hospitals. The federal government threw a lifeline.
It helped alleviate some of those added expenses and lost revenue that we really experienced in that first wave, so to speak. But it by no means made up the hole that was created. If I had to give you a number, I would say it filled in maybe 40% of the operational hole that was there. So no one got rich on CARES money. Let me dispel those rumors right now.
The problem is that money is now run out. And these rural hospitals are stuck with increased costs for delivering care, salaries that many times are double what they were pre-pandemic. But the underlying financial pressures are still there.
The senior director at Fitch Ratings, Kevin Holleran, issued an analysis this fall stating overall the healthcare industry is likely going to take another 2 years to recover.
About 75% of your revenues, they're fixed every year. You simply can't pass it on to anyone else. And about 75% of your expenses right now, labor and supplies, are under extreme duress. And that is not a tenable long-term solution without some level of transformational care.
Turning things back to Marshfield Clinic, in its third quarter report this week, it's maxed out the available 160 million lines of credit and is working with banks for additional cash support. While the system has brought in more money, seen more patients, increased its insurance membership, it's had a negative operating margin and losses alongside rising operating expenses that are outpacing the money being brought in. It stated the negative factors were offset by some system initiatives. Quote, management is focused on implementing various initiatives aimed at improving financial results through increasing volumes, improved revenue cycle, labor management, service rationalization, and reducing costs. Marshfield Clinic responded to our stories in a statement that reads in part, quote, great organizations continually reorganize to become more efficient, effective, and resourceful, particularly in today's environment, end quote. It continues to state much of what we reported, adding, quote, we owe it to our patients to adapt, and we fully expect to overcome those challenges successfully, end quote. Healthcare quality and stability are complex to measure as there are a lot of different elements at play, so this barely scratches the surface. It makes even comparing one medical group to another difficult, which is why we also did not compare the only other major provider in our area, Aspirus, on this story.